Called roids, gear, juice, and many other euphemisms, their formal name is performance-enhancing drugs, or PEDs. They are synthetic, man-made versions of testosterone. Testosterone is the hormone found in males that is necessary for muscle growth, deep voices, and other male characteristics. It is mirrored by the female hormone estrogen, which also has synthetic man-made versions. Women do have testosterone in their bodies, just like men have estrogen, but in the opposite sex, they are found in much smaller amounts. Body image issues have contributed to steroids over the last half century, have influenced people in their choice to use anabolic steroids. Conceptions of the male body are changing. Social media is saturated with images of male physiques that cannot be attained without the help of steroids. In his book, The Adonis Complex, Harrison Pope also says that this is partially due to the social media images that men are increasingly obsessed with their bodies. In some individuals, these obsessions can reach pathological levels. One case of this is called muscle dysmorphia, where the man himself would think of himself as too small or too scrawny. This causing him to take extreme measures, including the use of steroids. Similar to the eating disorders found in women who are trying to achieve the perfect physique. Social media is blamed for much of this, as well as the increasing incidence in body dysmorphia in adolescence. The controversy is mainly around the use in professional sports, though, whether they are banned legally or illegally. As we will see, these bans are put in place to protect individual participants from dire consequences to their physical health, their mental health, and as well as the sports that we play. Physical health. Healthcare providers do use anabolic steroids to treat some male medical problems, such as muscle loss from disease. The amount used, like any other medicines, is based on several factors that include age, gender, and any other health concerns that the patient may have. However, athletes who are looking to improve their performance, dosages are usually 10 to 100 times higher than doctors routinely prescribe. This is also called stacking, where the athlete ignores the damage that can be done. The most immediate effects that steroids cause may not sound very threatening. Acne, hair loss, change in how the voice sounds, and bloating are common symptoms. First, for the acne, the usual treatments are recommended, but the best solution would be stopping steroid use. A little more serious is thinning hair. Steroids can cause balding in people who are not normally or genetically predisposed to it. Usually, it's usually the overproduction of the hormone dihydrotestosterone. DHT is also necessary for the reproductive system. But if it's excessive, it can cause male pattern baldness and female pattern baldness. Male pattern is typically the receding hairline and the crown, and thinning at the crown. Female pattern baldness does not usually complete to balding, but usually begins at the center part and widens. While women can experience hair growth on the rest of their body while experiencing hair loss on their head. They experience hair growth in their face, chest, and hands. Now, it does not complete to complete baldness, but if it's excessive, it could. Deep voice is also found in both men and women because steroids affect the larynx and other muscles around it that generate verbal sounds. This change typically occurs in stages. First, the voice will begin to sound hoarse. Then it will alternate in a pitch. Water retention is often quickly experienced in men and women because of the hormone levels and electrolyte balance. These symptoms can include puffy cheeks, rounder faces, and swollen feet and ankles. In men, water retention is also called edema. Edemia is associated with extra estrogen and may require surgery in some areas because testosterone levels are not guaranteed to return to normal. Extra estrogen is also may be associated and put a strain on the cardiovascular health and lead to high blood pressures and other long-term and other issues. Long-term use can damage the eyes and result of infections, cataracts, and/or glaucoma. Adrenal suppression takes us into more serious effects. Adrenal suppression puts the user at a greater risk for both Addison's disease and Cushing's disease. Both can affect the adrenal glands because it could cause the glands to stop producing enough cortisol for the body's normal needs. Cortisol is needed during times of physical stress, like out of the ordinary physical activity, infection, and yes, when someone overdoses on anabolic steroids. Heart problems. In an American Heart Association study, researchers have found that the effect that steroids have on the cardiovascular health. They found reduced left ventricular function, as well as coronary artery disease. A team of researchers from the University of Birmingham also found that people with inherited heart conditions can experience changes to the heart and muscle structure and suffer from arrhythmia. Arrhythmia is a major cause of stroke. In this case, the electrical signal, when it tells it to beat, travels around the heart more slowly than usual. The former is when it beats too fast, and the latter is when it beats too slow. Steroids can increase LDL, which is bad cholesterol, while decreasing HDL, which is good cholesterol, and result in coronary artery disease, angina, heart attacks, and sudden cardiac death. Liver failure. Liver cirrhosis is also a medical condition that can lead to liver failure and liver cancer. It's usually caused by years of high consumption of alcohol or long-term use of certain medications, including the use of steroids. It disrupts the ability of the body to remove waste products from the blood, causing healthy cells to be replaced with scar tissue, because the liver is unable to break down and eliminate certain substances. This causes cancerous tumors. Globally, it is one of the most common types of cancer. The good news is it is treatable if caught early enough. Kidney problems. One of the kidney's many crucial functions is acting as a filter to remove waste products from the body. Bodybuilders frequently use dietary supplements such as protein, creatine, and vitamin to help build strength and muscle. But combined with anabolic steroids, it can lead to scarring and possibly kidney failure. Brain change. Although anabolic steroids does not trigger the same intense response in the brain like substances like cocaine, it still can create changes to the brain over time. Steroids are associated with structural abnormalities, shrinkage of certain areas, and influencing overall brain development. Long-term users also report symptoms that mimic Parkinson's disease, such as problems moving and keeping their balance, body stiffness, and tremors. Male-dependent steroid users appear to have a thinner cortex in widespread regions of their brain when compared to non-dependent steroid users. The cerebral cortex is the covering which is over the whole brain. Symptoms indicate whether or not it has been damaged. For example, if over the frontal lobe, symptoms would most likely be memory and attention issues. These changes can affect behavior, personality, decision-making, mood, and sleep patterns, which all factor into mental health. Mental health. Whether they are professional athletes, bodybuilders, or simply men who become dissatisfied with themselves, there's a greater likelihood that steroid users will suffer from depression and anxiety more than those who aren't. Some experience feelings of paranoia or irritability, also feeling aggressive or hostile after use. These mental changes are dangerous. Harvard Medical School psychiatrist Harrison Pope has provided some of the strongest evidence that long-term steroid abuse can boost aggression. In 2000, he published a random double-blind study that confirming that high doses of steroids increase aggression. Former athletes and bodybuilders were part of the group study, but even men who were never serious athletes experienced the same uncharacteristic amount of aggression. In 2007, Canadian wrestler Chris Benoit, known as the Rabid Wolverine or the Canadian Crippler, strangled his wife and son. No one knows why he was driven to commit this unspeakable double murder. But just before the incident, his wife had taken out a restraining order and filed for divorce. A variety of anabolic steroids and prescription medications were found at Benoit's house, and authorities were questioning whether or not steroids have caused a role in the double murder. After Benoit killed his wife and son, he hung himself with a cable in his gym. Steroids can have severe psychological consequences at any age, but they are especially damaging during the teenage years when the hormone levels are still in flux and the body and brain are still developing rapidly. Dr. Lynn Goldberg, who is the head of Division Health and Sports Medicine at Oregon Health and Science University, agrees. He says, quote, when you are giving steroids to a young teen, you are messing around with the hormones and Mother Nature. You are changing the course of development, end quote. Dr. Rich Maloney of Northeastern University in Wareham, Massachusetts agrees. He says, when you give steroids, he says, the teenage population is at a great risk for progressive outbursts because you are grossly overstimulating steroid signaling pathways when the brain is most vulnerable, end quote. Finally, steroid users commonly experience sleep disturbances, which worsen emotional issues, other emotional issues. Sleep deprivation increases psychological stress, decreases the ability to think clearly, to achieve goals, and to control our emotions. Users also experience having bad nightmares that continually disrupt their rest. Clearly, anabolic steroids can cause severe, long-lasting, and in some cases, irreversible damage, such as heart attack, stroke, liver cancer, kidney failure, and other psychiatric problems in people of all ages. Age, gender, the specific steroid that was used, the extent and duration when it was used, all factors into whether or not quitting will reverse the damage. Quitting, however, is not easy. Steroid addiction is like any other drug addiction. Withdrawal symptoms can occur within a few days or even several weeks after their use. A professional detox supervision is also recommended. The professional monitors the recovering user for depression and even suicidal behavior. They also offer behavioral therapy. The sports. The number of athletes who abuse anabolic steroids is unknown. All athletic associations and major professional sports leagues have banned these drugs, whether they are obtained legally or not, as well as the International Olympic Committee, or the IOC. These organizations include the National Collegiate Athletic Association, the Ultimate Fighting Championship, the National Football League, the National Basketball Association, the National Hockey League, and the Major League Baseball. But we will make the National Football League our case in point. In 1989, Atlantic Falcons offensive lineman Bill Frawley testified in Congress that an estimated 75% of linemen used steroids before the league began punishing offenders for it in 1983. Just a few days after that, 15 players from various teams were expelled from the league. 13 of them tested positive for steroid use. In a newly published database compiled by USA Today Sports, since 2001, 258 players tested positive for these banned drugs, just 82 in the past 5 years. The NFL players test positive the first time, face suspension. Upon testing positive a second time, they are expelled from the league. The NFL, fines for some teams often reach millions of dollars, which impact players' salaries and result in a negative press coverage. There's no wonder that these players won't come out to using anabolic steroids. The NFL does a multi-pronged approach to curb the use of steroids, and also Their testing season begins on April 20th of each year. If a player is notified for a drug test, they must complete within 4 hours, or it is considered a positive result. Next, during each season, the National Football League Players Association, or the NFLPA, randomly selects 10 players per team for testing, but no one player can be tested more than 6 times per year. Lastly, tests are done year-round. If a player tests positive in the off-season, they aren't suspended from the league, but they are referred to a substance abuse program. The NFL makes a good effort at curbing the use of these drugs, but they could do better. The UFC and the IOC are both good examples on how athletic associations could improve. The IOC led the way by creating a list of banned substances in 1967 and proved their determination to do so in the 1988 drug scandal that occurred at the Summer Olympics in Seoul, Korea. Ben Johnson, who was a Canadian sprinter, set the record, won the gold medal, and set the record for the 100-meter dash. But just 2 days later, after testing positive for steroid use, he was stripped of his gold medal and as well as his place in the record books. Instead, the medal was given to second-place winner, American Carl Lewis. Up until last fall, the UFC had the best anti-doping program in all professional sports, agreeing to the United States Drug Agency, the USADA, to their 365-day-a-year test policy, something like how the IOC handles their testing policy. Some protest, though, that it is hypocritical to ban all professional athletes from drugs when the general population utilizes these drugs. They say when done under medical care, it would make the professional sports more interesting. Well, the problem with that is that it presupposes that all athletes are more than willing to use these banned drugs. What if some are not? This also presupposes that sports is about winning at any cost. Should that be our attitude? Rather than playing sports is all about teamwork and achieving excellence? Introducing PEDs in the mix would simply give an unfair advantage to the players who want to win at any cost over the players who know that using PEDs is cheating. Despite the controversy it causes, steroids do have a few good things to provide, such as increased strength, increased athletic performance, and decreased recovery time. But we now know that they do more harm than good because they affect our physical health, our mental health, and the sports that we play. This matters to everyone who has been affected by these drugs, whether they are a bodybuilder, a professional sports player, or even just a private individual recovering from a drug addiction. God created us all. He made each and every one of us unique. We do not need to indulge in synthetic drugs to improve our bodies, because He loves us as we are. We do not need to impress our peers or think better of ourselves. Turning to Him for the help we need to accomplish our daily tasks is far more impressive than just adding 100 pounds to the bench press. Thank you. I'm now ready for the judges' questions.